The premier event for infection prevention and control is coming to San Antonio this June. APIC's annual conference brings you the latest research, innovative products, and practical knowledge to help you prevent infection. From inspiring keynotes to thought-provoking panel discussions, APIC 24 curates an extraordinary platform for knowledge exchange. Meet IPs from around the world who face the same daily challenges as you. If you work in infection prevention and control, you don't want to miss this event. Learn more and register to join us in person or virtually at annual.apic.org.
You're listening to the 5-Second Rule, brought to you by APIC, the Association for Professionals in Infection Control and Epidemiology. Together with our nearly 16,000 members, we strive to create a safer world through the prevention of infection. Join us while we talk to infection preventionists and other experts to learn the truth about some common myths related to the risk of infection and to get tips to keep yourself and the people around you safe from infection.
Hello, and welcome to the 5-Second Rule podcast. I'm guest host Marie Wilson. I use she, her pronouns, and I'm joined again today by my fellow guest host, Jay Liggins. Howdy, Jay. How's life treating you, my friend?
Life is pretty good. Yes, my name is Jay Liggins. For those who haven't joined us yet, my pronouns are he, him. Like I said, life is good. I just got done being sick, so I apologize for any creaking and cracking my voice does here today. And thankfully, though, it was not COVID. But to be honest, it's been a while since I've been sick, and I don't know if I could handle COVID.
I'm glad you're on the mend. Jay, it's come up a couple times in the episodes we've done together that you're newer in your tenure as an infection preventionist. Is that right? Would you say that?
I don't know. I guess I would. I'm somewhat newer. I've been in the game now for about 5 years, but I don't know now. Do we treat COVID years like dog years? Is it longer now? It is 5. It kind of feels like 10 over the past 2. But yes, I'm, I guess, relatively new.
Yeah, well, you're actually not too far behind me. So, what we're talking about today is really our APIC competency model and how we get it familiarized with it through the Novice Roadmap. Is that something you were able to use?
Yes, it was prior to the pandemic, because, the goal when you become an IP is to always, work towards getting that certification. And, something that when I first started, that roadmap really helped provide a sense of direction, especially as someone who kind of changed their career and education pathway a little bit in undergrad to epidemiology and disease prevention and infection prevention. Not really, I knew about infection prevention, but I didn't really know the role in everything that it entailed. When I first started, and that roadmap really gave me, a sense of direction and really an idea of what it meant to kind of find your way towards becoming an efficient and competent infection preventionist. For me, kind of leading into dating ourselves, it was a paper roadmap. And it was like one of those big law books that you'd print out. I apologize to all the trees that were sacrificed in the making of that document for me. But now it's electronic, I believe, right?
Yeah. I've used it in both ways. As I was coming up as a new IP, I used it as the paper version, also similar. I put 2 sheets of paper on each page, and I did it front and back. I tried to be as economical as I could with our green resources, but now it is online and it's very interactive. There's live links and it's all sorts of things. I've used that with a colleague that I was helping bring into the profession. It's a very engaging tool. So I hope our audience is familiar at least somewhat with these tools. If not, I'll just say it from the very top. Please check out the podcast webpage because we will have links to these resources there for you to easily access. Follow along as we talk today with our with our guests, which are two very special guests for us as they were authors of the roadmap that was originally published in 2012. So our first guest is Lela Luper. She is a certified infection preventionist and fellow of APIC, who is currently serving as manager of infection prevention and control at the Chickasaw Nation Department of Health in Ada, Oklahoma. Good morning, Lela.
Good morning, Marie and Jay. I hope you all are well.
We are. Thank you
Yes,
so
very
much
well.
for joining us
Good
today.
morning.
And we are also joined by Joseph Joey M. Scaletta, who currently works in the U.S. National Institutes of Health, NIH, Clinical Center as an infection control consultant. And he has been certified in infection control since 2007 and has earned the Fellow of APIC designation. Good morning, Joey.
Good morning, Marie. Good morning, Jay. Glad to be here.
Absolutely. Good morning to you both, Lela and Joey. Really happy to have you here today. Really to kind of discuss the Novice Roadmap. And I was hoping I could get your input in terms of, really how did we get to the creation of the Novice Roadmap? So,
Sure. The Novice Roadmap really was born out of the education committee. We realized pretty early on that, our profession is changing. A lot of us are going to be retiring in the next 10 years, and we wanted to create a systematic way in order to recruit and orient new infection preventionists so that they will have the skills that they need to do their jobs and eventually one day sit for that certification test.
I think we also realized at the time that there were a lot of, even to today, is that a lot of people in infection prevention are coming in to the career or into their job, and there's no one else to mentor them. So they're starting from scratch. They don't know where to go. And so we wanted to try to provide a framework and what they need to know in the first 30 days, 60 days, 120 days until they were able to get certified. And so the Novice Roadmap was built in a way that followed the competency domains for civic so that we could actually utilize the steps. And if you were an individual in your job or organization, you had something to go by, that you didn't necessarily have to have someone else to lead you. You could do it individually on your own.
I love what y'all say about it being able to be the guidebook for those people that don't have mentors. I will even say that I had a mentor that is the one that put it in front of me and was like, here you go. And it was just so nice to have the autonomous resource. So I think a lot of people, especially if they're coming in as infection preventionists right now, they might feel hesitant or a burden to ask questions if they don't know something. And it is so nice to have that resource in the roadmap where it's like, okay, I am just not getting anywhere in this project. Maybe what does the roadmap say about who I should partner with or who I should get to know? So I think that y'all did a really great job. And it wasn't just the two of you, right? You had others.
So we were talking about that, trying to figure out who actually were the core people. And we even really, when I stop and think about it, we actually went from an interdisciplinary approach to actually forming the roadmap. We had Kit Reed was the current education or EdCom chair. I was the vice chair. And then Janet Krigler came from a laboratory background. We have the current president-elect, Pat Metcalf-Jackson, was also a part of that work group, as well as Joey and again, myself was a part of that first version. But as we talked about, it's now interactive. We've gone from a first version to the second version, which, there are only a few hard copies of those remaining. And now it's interactive where you can get checklists, activities, a supervisor plan. You can get certificates of completion. It's completely different, which is really a blessing. I guess warms my heart to see that it has stood the test of time, and we continue to rework it into, something that it is today.
We were able to do so much more with the interactive version than we were with the paper version. And so I'm really thrilled that, so many IPs have use this resource, that APIC continues to support it. I've just anecdotally heard so many people get value from this roadmap, and actually, had some fun along the way. Like, I like to learn, but learning can be tough and challenging, and really challenge you. But the roadmap really was designed to have some fun along the way.
And I think, Joey, the other thing we were thinking about is, that people were thinking, well, what do you do with this, right? And so when we were working as a group, if you recall, it was like, okay, we want people to start here, but what we really spent a lot of time trying to figure out, what do they need to know in the first, 2 months on the job? What did they need to know? And then we just built on that. If you remember, we were going through that labor of love, trying to make sure that, each step made sense, and that the end user could utilize that, and so we wanted, if you will, mastery of the first 60 days before you moved on. But, at the same time, we knew that not everybody learned the same way. Right. And so that was one of the things I recall. We really just spent a lot of time trying to figure out what was the flow, and what was the right way to go about it. Yeah.
And one of the things that I actually love about the roadmap is that it's going to encourage you as a new IP to get up out of your desk and to walk around your building and meet people and talk to people and get to know other people in other departments and what their role is in your practice of infection prevention.
And I think that's still today, right? I mean, if you sit in your office all of the time, you don't know anybody and they don't know you. It really is about building relationships. And I think, really made sure that we took the time to incorporate that and made sure that people got to know who they would be collaborating with, because you do definitely in this career, in this profession, have to collaborate with others. So.
Absolutely, Lela. And, I'm really glad that you all started to bring up, facts in terms of, everybody learns differently and the flow of the roadmap. And especially for me, when I was printing out in a printed version, I kind of essentially read it and went through it like a book, left to right, one page after the other. And, I guess that's one way to do it. But, with it being online now, there's multiple different ways to, move through the roadmap. So I'm wondering, Lela and Joey, are there any do's and don'ts that you have for those beginning to use the roadmap? Should we still move through it like a book, go around, jump around, do different activities?
Jay, I think you hit the nail on the head. Don't read it like a book. You're gonna come into infection prevention with strengths and some areas that you can strengthen upon. You should sort of tailor the roadmap to where you are in your journey. So don't read it like a book. Skip around, and not everything's going to be quite so linear. It was meant to be sort of tailored to the individual.
So to that end, it'd be really easy to Google everything. So we're going to tell you, don't Google everything. Utilize your resources. And in the roadmap, we give you, for each stage, different resources to utilize. And that builds your library. As a good IP, you need to have your library. And so utilize the resources, and the roadmap helps you identify those resources as well as gather those so that you have them for your library.
That's a great point, Lela. Like, if you see a link in the roadmap, go ahead, just start bookmarking those, because we selected those links with a lot of care, and they really are the standards and the recommendations that you'll use in your practice every single day.
I think you also need to understand is that the roadmap is really just a range or a general framework. So while it says in the first 60 days or 61 to 120, that doesn't mean that again, everybody learns the same way. So it's very possible, as you're skipping around, that you feel like you have better expertise in one area than the other. But it was intentionally built as a general framework for completion, not that thou shalt have this done at the end of 2 years and ready to take your certification exam.
Yeah, I'll say from my experience, in not everyone learns the same way, is not everyone gets the same opportunities at the same time either. So when I came in, it was very quickly, we had one of the CMS audits on our hands. And so it's like, oh, what do you do here? And so understanding the role that CMS plays in the infection preventionist work and getting more familiarized with NHSN in that moment, definitely guiding myself towards that part of the roadmap and those sections related to surveillance was how I learned in that instance, where it might not necessarily follow the flow of the timelines outlined, but then also bringing in my background as a nurse. So having left the ICU, very familiar with many of the devices that are used. But I got to tell you, until I was at my first interdisciplinary rounds where the pharmacist was talking about the antimicrobial therapy the patient was on because of the gram-positive cocci that was growing, microbiology did not click for me until that day as a bedside nurse. And so I knew that was definitely where I needed to focus my time and energy. And I still, to this day, that those are still where my gaps are. And I can still use the roadmap and its resources as I continue to try to move through my proficiency as an IP. It's fun to be able to have fun with it.
You said something that made me think about, with regards to accreditation, whatever you're in, if it's a CMS or DNV or any other type of accreditation that you're trying to receive, is that sometimes they're looking for how do you show your competency. And, as we were building this, we're thinking, okay, if people if they're a new IP and they're working through the Novice Roadmap, they can show whomever their accreditation friends, this is what I'm using to be able to educate myself, which is, great from a professional practice standpoint because it came from our professional organization, APIC, right? So, another thing, I want you said something about, just because you've done it, right? Mm-hmm. Well, that's another don't presume that because you've read it or lived it that you know it,
Yeah. That's a great point, because honestly, I thought I knew what a CAUTI was when I was at the bedside. I was one of our CAUTI champions and all these sorts of things. And every time I saw a positive urine culture, I was like, oh, another CAUTI. And, it's a much more nuanced definition than that. And I didn't really fully appreciate that until I was in that phase of becoming an infection preventionist and applying the definitions and using the roadmap for me to help educate my peers who are still back at the bedside. Like, don't get discouraged by the positive culture, but let's learn from it. Yeah.
Absolutely, Marie. And, I think you, Marie, and Lela have touched on something pretty important in regards to the roadmap here, is that you can use it at any stage of your infection prevention career. Like, yes, it is the Novice Roadmap, but really it's something that you can continue to use as a competency check, like Lela touched on, every year, every couple of years, especially after you get your certification. It can help you, just stay proficient on the areas you're weak in, even the areas that you're strong in. Because the one thing about our profession that I've learned over the past few years is that we are always continuously learning, either learning something new or relearning something that we've already touched on, just learning, relearning, and re-educating for the staff that we work with. That is something I think that is pretty special about infection prevention.
And to your point, Jay, I mean, I think that one nice thing about the roadmap is that, we're all coming at infection prevention with different backgrounds. We see many more MPHers or epidemiologists coming into the field. We see a ton of people with lab backgrounds and still a lot of nurses too, right? But they can all use the roadmap to fill in those gaps. I think Marie was talking about how, sometimes the micro part was hard and she maybe had to work a little harder at that part of it. So the roadmap was designed to really be a multidisciplinary approach to help that new infection preventionist, get to where they need to be to sit for certification.
So to that end, Joey, I was looking up just some past history about how the Novice Roadmap had been used. And in 2017 at the APIC annual conference in Portland, there was actually an abstract that was submitted about the use of IP interns. And they were actually one had an MPH background, one had a med tech background, and both of them they had the mentor IP that helped them work through the roadmap. And it was noted that their strengths for each individual, both the MPH and the MedTech, were in two different areas. Their weaknesses were in two different areas, but the mentor IP for them were able to help them walk through that process. And they eventually were hired, as part of the program, which was a really cool thing to be able to see that come to fruition too, right? But I think we need to think we've so far thought about it as an individual. I mean, as a manager or a director of a program where you've got new IPs coming in, I think we need to remember that while we can hand them the Novice Roadmap or give them access to the interactive roadmap, it's really important that we don't leave the new IP alone in order to self-study on them by themselves. Do you agree, Joey? What would you? Yeah.
Absolutely. And, sometimes I'm fortunate. I have 3 other IPs that I get to work with every single day and learn from them. But sometimes you may be the only IP. If you don't have someone with specialized infection prevention training, lean on your local APIC chapter. They can help you with the roadmap. If you're struggling with something, or maybe your facility doesn't have a service line that is being talked about in the roadmap, go visit your IP colleagues. I found that the infection prevention community is super warm, super welcoming, and will help you get everything checked off.
I think the other thing too is if you are in a position to where you're managing new IPs, you could definitely make sure you're scheduling regular check-ins with them. Have those conversations about the resources. Have they tapped in? Have they bookmarked? Where are they at? And that's just not handing it to them. So I would say, that's another do with regards to if you're in that position. I think using the roadmap as a self-assessment is really important as well. So you can utilize that along with the competency assessment that's been built. So there's a lot of great things you can do with the Novice Roadmap, and we hope that our new IPs and maybe even seasoned IPs will every once in a while just pick it up and take a look and see, where they can brush up on their skills and activities.
Absolutely. And Lela, I wanted to kind of circle back a little bit and touch on the check-ins that you mentioned, especially for myself who's new to training new IPs here and using the Novice Roadmap to help train them as well. How often do you think, and Joey, you can weigh in too, how often do you think these regular check-ins should occur for new employees going through the roadmap?
Well, I just actually happen to have a new hire, and we're going through that now. And we spent a little time looking at the Novice Roadmap and trying to first decide, how did they want to go about it, and once we made that decision, I said, okay, I'm going to check in with you in about 6 weeks. We're just going to sit down for about an hour. Between now and that 6-week time, you're right next door to me. I expect that if you are working through it and you have questions about where to find who that person is, what this means, that we're still interacting. So I set that 6-week hour block time just as a touch point. But the idea is you're still having dialogue within that time, right? So they're not alone. I happen to be in the introduction, rural healthcare, right? So we're small, but they're right there. And so really that doesn't mean just because I did that hard stop, connect time 6 weeks that all communication there's no communication in between that time. I don't know. I think it can be what we call it depends answer, It's one of those, it depends. I think you got to be able to have some emotional intelligence and understand who you've hired, how they fit into the program, do some assessment of them, how do they learn? What do they, do you need to have more frequent touch points? I think that's fair. For my current new hire, I've said it, we're going to meet in about 6 weeks. And the other reason why we did that is because it's amazing how fast 4 weeks flies. And you're
gosh.
like, oh, wait a minute, but you're still trying to do all of the other onboarding things that need to happen along with working through the Novice Roadmap. So, Joey, anything different? I mean, do you approach it a different way with new hires?
No, I would tailor it to the individual. I've had new hires that wanted to meet a little bit more frequently, like every other week, just to make sure that they were on the track. The right track. I think as we progress through the roadmap, I've noticed that maybe that frequency increases. So instead of every 2 weeks, it might be every 4 weeks. Once we get started. But I don't think that there's a right answer or a wrong answer.
Yeah, I would like to add in that I think as the manager as well, if you're keeping in mind where your new hire is in relation to the roadmap, as you have meetings coming up where they can naturally come and just get introduced to some of the key stakeholders that are a part of the Novice Roadmap. Mm-hmm. That's really nice too, because then you're not having to establish the kind of one-off awkward, like, hello, I'll come to your office and introduce myself, but it's a bit more natural and everyone's seeing each other in kind of their natural state while that new IP is getting operational understanding of the organization too. And so that's a way that the self-study is not necessarily the way that it's going and you're facilitating them through as the new manager. But I think tailoring it to the individual, and in order to do that, starting with the competency assessment, right? So with my new hire that I had, it was, let's sit you down. They had an MPH background, so they had a wealth of information related to public health and surveillance and epidemiology and these sorts of things. But when it came to the more of the nuanced antimicrobial stewardship and these types of things, that's where they needed the room. And so by having that kind of baseline, we could reassess, and then you could reassess the time frame. But I definitely, I love this tool so much. And one of the things that I liked, it's obviously a planted question, but is there anything like it in other professions?
I don't think that there is. There's similar things. Like nurse residency programs help train up new nurses that have passed the NCLEX and are working on the floor for the first time. But for our profession, I don't think there is anything like it.
Yeah. It's like I said, Joey, it's a planted question because I'm just so proud of the work that you guys have done and the resource that you and your colleagues made. This was really a life-changing tool for me. I felt like I was going to be able to be confident.
That makes my heart happy. Not you, but it makes my heart happy. Well, and we would be remiss. I mean, we may have been part of the original group of authors, right. But as I mentioned at the beginning, it's had a second revision and now it's interactive. There are people, volunteers, other infection preventionists, that have been a part of making that happen. So that a shout out to them for their work and time spent too, because we know, Joey and I know, that it wasn't easy initially. And as you're looking at the material, even though there was a baseline for it, I know there had to be some more work and time spent for that. So we need to be thanking them too for continuing to have that resource available to new hires and to new IPs.
Pretty soon we're just going to have to drop the novice term. It's just the roadmap, right?
We've
talked a lot about how we're all still using it and we learn from it. It's just a really great tool.
I think another question we often get, and we try to address with the original version, if I'm not mistaken, this is addressed still today, is that, the presumption, if I do the roadmap, will I, get certified? Will I pass my CIC exam? And I think that was a tough question that the five of us originally really had to ponder and ask ourselves, is it possible? And I think the answer, you definitely add in, Joey, but the answer for me was, yes, it's possible. It's not your only resource, though. Don't fully depend on the Novice Roadmap. There are other resources that APIC has. There are other people like your local community chapter that you could tap into with regards to for certification. So this wasn't a guarantee, but it was definitely put out there to at least help navigate to that endpoint. Joey, what do you think?
I absolutely agree. I think CPIC does a great job of highlighting other resources in the candidate handbook that are helpful. I know that so many chapters have put together certification study groups. APIC offers additional pre-conferences and certification reviews. Take advantage of all of that, especially if you work in a smaller facility that you may not have access to a wide range of services, because you may need a little extra because you're not getting that in your day-to-day practice.
Totally agree.
Awesome. Well, Lela and Joey, this has been an absolute pleasure. Before we let you go today, we'd like to ask you 2 questions. We're asking every infection preventionist that joins us on the podcast. So we'll start with Lela first. Lela, what's something you've learned about yourself as an infection preventionist that you didn't know 3 years ago?
Focus on the big things. Don't major in the minors. I don't have to live and breathe IP. I need to allow myself that mental respite, usually in the form of retail therapy. But yes, I really have had to give myself some grace.
Mm-hmm. I got chills.
And we all know what we've been through for the past 3 years, but definitely, focus on the big things. Don't major in the minors and allow yourself to not live and breathe IP. Give yourself mental respite in whatever form of fashion you need.
That's wonderful. Joey, how about yourself?
Mine is actually very similar, and we did not talk about this beforehand, so it's interesting. And I think what I've learned in the last 3 years is that we as a community of infection preventionists, we are a resilient bunch. We've been asked to step up. We as a community have stepped up. But resilience is limited without self-care. We've got to take care of ourselves, and I think that we've got to take care of each other. Just checking in, making a phone call to your IP buddy down the road. Are you okay today? How are things going? That simple phone call means so much and can really change someone's day. So resilience, but only in the context of self-care and care for each other.
That's really great, Joey. Thank you both for that.
Yes.
So there's
Thank
another
you.
question. Jay, do you want to ask them our second question?
Sure. So I'll start with Joey this time. What are you looking forward to in infection prevention? So the future of infection prevention.
I am absolutely looking forward to the next generation of infection preventionists. I am looking forward to learning from you all. I am looking to you to carry the torch. I've got another 10 years, and I can't wait to see what you guys do.
Thank you. I hope I don't disappoint.
You won't.
Lela, same question. What are you looking forward to in the future of infection prevention?
I'm excited. The board of directors over the past couple of years has worked really hard on some new strategic initiatives for our profession. And I'm really excited to see those play out and get implemented in our field and what happens with those, as well as, just realizing infection prevention is no longer in the traditional acute care hospital setting. It's moving out into non-traditional settings in the continuum of care. And where's that going to go, and what's going to happen? It's going to take us much further than we are even at this point. And I think we've, have made it so far in my 20 years, but like Joey, I still have a lot more time left, I hope. And so I'm kind of excited to see what comes next.
Jay, I would just add, you are already not disappointing them, right? This has just been a great time. Both of you, thank you so much for talking to us about the Novice Roadmap. And we hope you take care.
Thank you for having us.
Yes, thank you so much.
All right, listeners, Jay and I are excited to showcase another new segment for you on today's podcast episode called Let's Hear from Peers. We invite listeners to visit our podcast webpage at www.5secondruleshow.org and leave us a voicemail by selecting the button on the top right corner of the page. We welcome you to share your feedback on episodes, a funny story from work, maybe a success story in your professional work, or just to say hello. We'd just love to hear from you. Today, we have a recording from Bridget out of California sharing a helpful strategy for a common frustration we may all share.
Back to basics is always a day-to-day concern for an IP. What is the best way to encourage the staff to properly dispose their surgical masks? While rounding, I observed that there are used surgical masks on the workstations near the keyboards, and sometimes I would see them hanging on the pockets of the medical team. So an effective IP messaging that I have used is to simply say that the surgical mask is performing bacterial filtration, and since we have level 3, these masks are really effective because they have 98% efficiency. So after that messaging, I now rarely see people putting the masks on the workstations, and I seldom see the staff putting them inside their pockets.
Thank you, Bridget, for the voicemail you submitted here today. I really think, for me, in my personal experience, mask management kind of is an ebb and flow depending on our COVID transmission in the community and what we're seeing in the hospital. For me, it's been, when transmission is high, I've seen pretty good mask management. Everybody's wearing it above their mouth and nose. There's no masks all over the nursing station or their wows. But when community transmission is low, we get a little lax in terms of mask management, masks on our chin, masks kind of all over the place in terms of not properly disposing of them. So, something that I've been able to do in terms of, trying to increase better mask management and compliance is just reminding our fellow staff why we're doing what we're doing every day, to make sure that our patients are staying safe and our staff and our fellow coworkers are staying safe. Nobody wants to be out of work sick. We all need to make that money. I know about it too. You got to save that PTO for vacations. Marie, have you employed any techniques to help increase mask compliance and mask management at your facilities?
Yeah, I love how eloquent Bridget was in just saying really a pretty complex understanding. This is for bacterial filtration and that it worked. I love that. We knew that when we had to start using personal protective equipment like masks outside of our preferred methods for use, that there were going to be these bad habits that were formed. So when we had to have prolonged wear or we had to have reuse, I think a lot of infection preventionists everywhere cringed and still continue to. I have always just harped on it's ear loops only, touch the ear loop only. I think a lot of people do miss what Bridget touched on, which is that it's not killing the bacteria or viruses that land on the surface of the mask. It's just holding it there in sometimes really high concentrations based on what you've just been doing. And so I have been that person that's walking the hall and see the provider with the mask pulled down around their throat and stopping and saying gently, oh, did you know that the way that's working is this way? And so kind of similar to what Bridget mentioned. And I've been thanked for it because don't think people understand how those are protecting us. And maybe they do more so now. But in general, I'd really try to harp, it's ear loops only, and then just modeling the way. Still to this day, the only time I am touching the box, if you will, is when I am putting it on. I fit it to my face and I do not touch it again. I'm a bit regimented in that way. And so you'll even see me at times. I just recently got back from a trip where I flew across the country with my spouse, and I had to sit there and correct him about how to wear his N95 respirator, because that's definitely not a mask that he's used to wearing, but we've had to escalate what we're comfortable wearing on planes as less people around us are wearing masks. So no, that's a great tip. Would love to hear from other people if they've got something creative and quick, something you could maybe even say as you're wandering down the hall that doesn't feel like you're yelling at whoever you're talking to. You gotta be gentle there.
Yes, absolutely. That's the important part, right?
Yes.
Gentle reminders.
Gentle reminders, without them being too obscure. I actually had a organization I worked at once. When I joined there, they had this code phrase for reminding people to do hand hygiene, and it was, "Have you seen Hannah?" And the joke I always made was like, "Well, who is Hannah? Is that my patient down the hall?" Like, no, why? Is she on the floor? Like, that could be a triggering question. And maybe not everyone understands Hannah means hand hygiene, but how can we gently incorporate these reminders with our colleagues? How can we get other people outside of infection prevention to be providing these reminders too, right? How can we kind of help it spread? But no, that was a great question by Bridget. And if anyone else has other stuff to share, again, visit our webpage at 5secondruleshow.org. There's a really easy to use button up there at the top. We just want to hear from you. So whatever you feel like sharing, it might get played. So keep that in mind, please. But we'd really love to hear from you all.
Yes, absolutely. And, I got to tell you, Marie, now, ever since you've said, "Have you seen Hannah?" I have it playing in my mind that should be like the title of an infection prevention horror movie. Like, "Have you seen Hannah?" And then it just, have all the scary, creepy music, eerie music playing in the background, people doing hand hygiene, not doing hand hygiene, and maybe like an auditor coming out from behind like a closed door. That's what's going in my Halloween themed brain right now.
Okay, Jay. Now, this is perfect and completely unexpected, but everyone keep in mind that every year at annual conference, there is the video for hand hygiene, right? The video submission contest.
Oh, yes.
And it's typically submitted in January, if my memory serves me. And so maybe, Jay, you've got a concept there that you should develop a little bit more. I think that's hilarious.
I will have to definitely look into that and maybe submit something here. Oh, man. But like I said, it's been a blast, Marie. It always is. And to our amazing listeners, if you want to know more about today's discussion, resources are available on the webpage for this episode. Visit www.5secondruleshow.org. That's with the number 5. We want to hear from you. So please rate and review us wherever you listen to this podcast. If you have something you want us to highlight in future episodes, send us an email at 5secondrule@apic.org. Again, that's with the number 5. We are so very appreciative of the hard work each and every infection preventionist is doing and putting in on a daily basis, making this world a safer place through infection prevention. Thank you for listening. Stay safe, and we'll see you next time.